Welcome, future medical professionals, to today's lecture on retinal hemorrhage. Over the next few hours, we will delve into the different types of retinal hemorrhage, including their causes, clinical presentations, diagnostic techniques, and management strategies. By the end of this lecture, you will have a comprehensive understanding of subretinal hemorrhage, hypertensive retinopathy, diabetic retinopathy, retinal arterial macroaneurysm, retinal vein occlusion, retinal hemorrhage and coagulopathies, traumatic retinal hemorrhage, Terson syndrome, retinal hemorrhage in acute leukemia, retinal hemorrhage in infectious diseases, retinal hemorrhage in vasculitis, and retinal hemorrhage in retinoblastoma. Subretinal hemorrhage is a specific type of retinal hemorrhage that occurs beneath the retina. It can have various causes, including age-related macular degeneration, idiopathic macular telangiectasia, and myopic choroidal neovascularization. Patients with subretinal hemorrhage may present with decreased vision, metamorphopsia, or scotoma. To diagnose subretinal hemorrhage, ophthalmologists utilize various imaging modalities, such as optical coherence tomography, fluorescein angiography, and indocyanine green angiography. Treatment options for subretinal hemorrhage depend on the underlying cause and may include anti-vascular endothelial growth factor injections, photodynamic therapy, or surgical intervention. Hypertensive retinopathy refers to retinal hemorrhage associated with hypertension. Chronic hypertension can lead to damage of the retinal arterioles, resulting in microaneurysms, retinal edema, cotton wool spots, and retinal hemorrhage. The Keith-Wagner-Barker classification system is commonly used to grade the severity of hypertensive retinopathy. The pathophysiology of hypertensive retinopathy involves the hypertensive damage to the endothelial lining and the subsequent disruption of the blood-retinal barrier. Management of hypertensive retinopathy primarily focuses on controlling blood pressure through lifestyle modifications and pharmacotherapy. In severe cases, laser photocoagulation or vitrectomy may be considered. Diabetic retinopathy is a common condition in diabetes that causes bleeding in the retina. Diagnostic techniques such as fundoscopy and imaging help detect and monitor this hemorrhage. Treatment options include controlling blood sugar and blood pressure, along with injections, laser treatment, and surgery. Complications include macular edema, retinal detachment, and glaucoma. Retinal arterial macroaneurysm is a rare condition involving localized dilation of retinal arterioles. Its exact cause is unclear, but it is often linked to high blood pressure and atherosclerosis. Retinal hemorrhage is a common sign. Diagnosis includes fundus examination, fluorescein angiography, and optical coherence tomography. Treatment depends on the size, location, and complications, ranging from observation to laser treatment, injections, or surgery. Retinal vein occlusion is a condition where the retinal veins are blocked, causing impaired blood flow and resulting in retinal hemorrhage. There are two types: central and branch occlusion. Risk factors include hypertension, diabetes, and glaucoma. Patients may experience sudden vision loss, visual field defects, and specific retinal hemorrhage patterns. Diagnosis is confirmed through exams like fundus examination and optical coherence tomography. Treatment involves managing risk factors, anti-vascular endothelial growth factor therapy, laser photocoagulation, and surgery in certain cases. The prognosis for retinal hemorrhage and coagulopathies depends on the specific disorder and its management. Timely diagnosis and appropriate treatment can help prevent further hemorrhage and preserve visual function. Regular follow-up and monitoring are essential to assess the effectiveness of treatment and prevent complications. Note: this summary is at an intermediate level of complexity and includes relevant terminology and details for medical students. In the video on traumatic retinal hemorrhage, we discuss how direct ocular injury can lead to retinal hemorrhage, the various mechanisms of injury, clinical presentation, diagnostic methods, management strategies, and potential complications associated with this condition. The prognosis of Terson syndrome depends on the extent of the intracranial hemorrhage and the response to treatment. Early intervention and interdisciplinary management are essential for optimizing outcomes. Retinal hemorrhage can occur in acute leukemia due to low platelet count and abnormal blood clotting. Diagnosis involves thorough examination and treatment involves addressing the leukemia itself. Prognosis depends on the type and stage of leukemia. This section of the video will provide an informative discussion on retinal hemorrhage in infectious diseases, including endocarditis, HIV/AIDS, tuberculosis, and viral infections. It will explore the mechanisms, diagnostic modalities, and management strategies for this condition. The prognosis of retinal hemorrhage in vasculitis depends on various factors, including the severity of the vasculitic disorder, promptness of treatment initiation, and the extent of retinal damage. Overall, early diagnosis and appropriate management are essential for optimizing visual outcomes in patients with retinal hemorrhage and vasculitis. Retinoblastoma is a rare eye cancer in children that can cause bleeding in the retina. This can be detected through symptoms like white pupil, crossed eyes, or vision loss. Diagnosis involves clinical evaluation, imaging, and biopsy. Treatment depends on tumor stage and may include chemotherapy, radiation, or surgery. Prognosis depends on early detection and proper treatment. In conclusion, retinal hemorrhage can come from various causes, each requiring a detailed understanding of their mechanisms, symptoms, diagnosis, and treatment. By integrating knowledge from different fields, we can provide better care. Thank you for your attention, and I look forward to exploring this topic further.